A very, very good morning to all of you who are present. Sri Ravi Gupta ji, Ranjan ji, respected dignitaries, the secretaries of health from the various state governments, the representatives from the various technology companies in the space of health, the practitioners who are at the cutting edge level. It's a wonderful opportunity for all of us to take out time and be over here in a space which is so extremely significant and important for the country. I would just like to share an experience of a few weeks back. I was at the ICT and Health World Conference in Maastricht. I was there is not important. What was important is India was an invitee. India was given an opportunity at the world stage to be a keynote speaker. And India was the only country which at the main platform, not on the other sessions, got an opportunity to showcase the work which is being done in the space of e-health in India. And that speaks a lot about the significance of this topic, the area, the domain for which all of us are gathered over here. It's a matter of coincidence that the magazine is called eHealth, which came in 2005, I just learned, or 2006. And the division in the ministry I'm heading is also called eHealth. Or rather, I would call it as not a coincidence. Because if we see that human civilization has been shaped by technology, whether it is the fire, whether it is the wheel, whether it is the modern communication technology, the antibiotics, the printing press, some fundamental changes. And if we see today, then the health space, there is a churning. We are at the cusp. If we feel that technology has really arrived, then we are yet to see in the health space how technology is going to come. As I can see, and as I was fortunate to see, as in the World Health Conference. Now, let me give you a glimpse of what is the digital health mission in India, what are the salient elements, and I'm sure you will all be able to connect. As I was flipping through the pages of the eHealth magazine, I could see the project called telemedicine. I could also see Abha. And a few years ago, with the coming of the Aadhaar, the Jam Trinity, the mobile, we see what a revolution has happened in the fintech space. And a similar change is about to happen in a few years in the digital space of health sector in India, where we have the concept of interoperability, where we have the concept of we have access to our own electronic health records, where we have the concept of taking those health records to other, and standards are going to be laid. Rather, they are being laid, and as Rajiv ji and I were discussing about a conference which takes place in Indian Institute of Sciences a month back, as to how we are to proceed further. So, can we proceed with or do we have any toggle for the PPT? I keep on saying next. How do we want to go? Okay, please move to the next slide. So let me begin with what is our long-term vision. Every vision has got a goalpost, every vision has a milestones, and every vision has certain constraints. Where does technology come in picture? Technology comes in picture to attain those vision as well as to overcome those constraints. So universal health coverage is definitely a milestone for us. It's a vision for us. But how do you achieve that? And we have 3 pillars of our vision, the means to achieve that universal health coverage, and that is availability of health facility, accessibility to health facility, and for India, as I said at the world platform, affordability of health services that is so important. And if we see availability, how technology is making available, if you flip through the pages of the magazine, we talk about the telemedicine service, e-Sanjeevani service, as to how in the remote areas, it is making e-health and health services available. People are able to get access to the experts which they were not able to get access to. And in that World Conference, we had a WHO director who showcased, who specifically spoke about as to how telemedicine in India is not helping only in the health sector, but he brought out statistics that how it is also helping to cope up with global warming. That these people who would have to travel from the villages to the districts and from the districts to the state centers, these people have not to travel. And he showed that how many miles were saved, how much of CO2 emission was saved. And that is the power of technology. So we have the establishment of the digital health ecosystem, creation of electronic health records, which I was talking about, citizen-centric health services, ensuring longitudinal electronic health record, which is a very, very important element and which with all of us have to gear with, the hospitals, the medical practitioners and the private citizens. Just as the revolution happened in the fintech space, something similar is going to happen maybe in a few years' time in India. Setting up pan-national telemedicine network, the Government of India Ministry of Health has played a crucial part in it. Optimal use of IT and surveillance and monitoring programs. How? A snapshot I'll try to show. Integration of national and state programs in a common framework. Next, please. So, the focus area on the digital health is essentially creating an enabling environment, need for governance framework, which is extremely important, digital health policies, implementation, and capacity building. Now, what are the strategies, what we can call the pillars? First is planning and monitoring, in which we have areas like Ayushman Bharat Digital Health Mission, which is an extremely, extremely important area. And I don't think there'll be any magazine in the world pertaining to electronic health which will not be, very eager to cover as to how we are embarking on this. Even the most advanced countries like Netherlands in health space, European Union in health space, they are struggling with the issue of interoperability. How do you maintain the issues of data privacy? How do you maintain the issue of data security and health standards? And myself being part of OECD Global Forum as an information security expert for the last 6 years, I understand the significance of data security, and I have to awaken the health sector that once we embark on interoperability, once we embark on the issue of exchange of data, health data, records, then we also have to be very conscious about the fact of data security. How do you maintain data security? Health sector is not immune to attacks as we have seen in the past. Be it government, be it private sector, you have to take appropriate measures for maintaining data security. Unlike the financial sector where the current data is important and as we grow older, the data becomes less relevant. In the health sector, the reverse happens. As we grow older, the data becomes more and more important and it has commercial value, and therefore, data security is so important. Next. Ayushman Bharat Digital Health Mission. Now, as I said, who wouldn't like to talk about it? This is one platform which is integrating the central government, the state government health sectors, the private hospitals, the private practitioners, the government service health practitioners, the insurance, the service providers. And it is talking about what is going to be the data standards, what is going to be the interoperability standards. And this is something which even Europe is talking about, trying to bring on legislation which India has brought. We have seen the DPDP Act and other provisions of the IT technology. And just like Aadhaar was the fundamental, we have in the health sector Aabha, which is essentially an identifier, which is again based on Aadhaar. We have more than 345,000 doctors which are already registered, 264,000 health facilities registered, and 1,805 active health integrators. Next, please. Now, giving you a snapshot, we have a disease surveillance program. This is built in collaboration with the World Health Organization and NCDC, which serves as a high-level indicator as to in which area of country drill down to a particular district, which particular disease is spreading, based on artificial intelligence, based on the concept of understanding of the symptoms and syndromes and the final reports of the lab. This extremely powerful engine has been built, which is indicating a heat map, as I mentioned, drill down to the ground level as to what is happening so that appropriate policies changes, appropriate actions, appropriate advisories to the state government, coordination at the district level, these can be done. Next, please. The magazine talked about e-Sanjeevani, and of course, this is a flagship program. And what do we have? We have nearly 26,000 hubs which have been created all over the country. And we have a large number of spokes. At the spoke level, we have the PHCs, the DHCs, and other health services facilities. And where the citizens from the rural area who didn't have access to health services, they can simply walk in. And over there, they'll be connected to the experts. But e-Sanjeevani is also a facility where a private person who is desirable of availing the health services can simply log on, can dial in for health services, consult an expert, get a medical prescription online, and based on that medical prescription, he can get a medicine issued. Now, this is something unthinkable of. In the age of Google, we try to, give what is my ailment and try to decipher which page I read. These are certain cutting-edge technologies which are helping us with the principles of affordability, accessibility, as well as availability. So what do we have? We have a 241 crore people who have been consulted. And in a single day, we have a higher number of more than 6.3 lakh people who have consulted. Next, please. Now, we have this National Public Health Observatory. During the COVID times, all the decisions as to how disease is progressing were taken in what we call the war room. And this is an integrator of more than 40 applications of the central government, of the health, which is bringing out the KPIs, the data analytics, and bringing it in form of a large dashboard. And similar endeavors, similar measures have also been adopted by many state governments. Next, please. AI. Now, we often talk about AI. Can AI make inroads? It is already making inroads. And we have some very exciting projects which are already going on. We have the media scanning and event-based surveillance, which is linked with our NCDC WHO project, which also indicates as to if there is an outbreak of any particular communicable disease in a particular area in the country. We have the clinical research support system, which is integrated with e-Sanjeevani, which is helping the doctors to make quicker decisions as to what sort of symptoms we are seeing and what sort of ailments can possibly be. We have in AIIMS Delhi high-level research which is already going on, identification of diabetic retinopathy based on the image which has been captured, the triaging for abnormal chest x-rays, again in AIIMS, oral cancer screening, detection of dermatological conditions, 14 conditions, which is extremely ambitious because just based on the image, giving the skin tones, it is very difficult, but it's a very challenging one. And assisting the ground level health workers. Next, please. In the space of education, again we have technology, as we can say, which is coming in place. And Saksham is a platform where we are integrating country's various medical colleges. We are preparing lectures and video lectures which are being used for the purposes of education and spread of digital awareness, health awareness about the various medical colleges and their students. Next. India is playing a significant role as far as health is concerned and as far as technology in health is concerned. And India's role is being recognized worldwide. especially after the pandemic and especially given India's IT prowess. So, as I tried to showcase that technology in health sector or e-health is an extremely important area, the government, the state government, the central government all have taken important measures, but all is towards a common goal, and that is health for all. Now, as in 4,000, 5,000 years ago in the Upanishads, it was said, Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashyantu, ma kasyit dukh bhag bhavet. Which means that may all be happy, may all be disease-free, be healthy, may all have a good vision, good thought, and may all not suffer from any sorrow. With these aspirational quote, I end what I have to sharing what is the initiatives of government in the health sector. Thanks a lot.